The back has been finished onto the gluteal area, and in this particular case it's left covered up because some people are really sensitive about this region here. So keep it covered. The palm of the hand just squashes the muscle, gluteus maximus in particular, and then a fist. So that's much deeper. Slow down, and just be careful you're not hitting bone. As if you're making any referrals going down their leg via the sciatic nerve. Give it a good shake, make it happy. Into the gluteals, palm of the hand. And fist. Make it happy. Onto the thigh. The thigh is exactly the same, back and front, except of course just be careful of this area here. It's called the popliteal fossa. There are nerves, blood vessels and lymph nodes in that area. Pressing on may hurt. Upper hand picks up, lower hand slide and squeeze. Upper hand picks up, lower hand slide and squeeze. So you're squirting all the fluid up towards the heart. Either one hand on top, side by side, lean on heavy. So this is onto the hamstring region. Really soft hands, but you can lean on heavy providing it's not hurting you and it's not hurting them. Alternate hands. Open your hands really wide, squeeze, lift and roll. Cover the leg. Spread the oil over the legs. The inside of the thigh, upper hand picks up, lower hand slide and squeeze. Both hands lean on heavy. Alternate hands. Squeeze, lift and roll. Turn and face them. Alternate thumbs. Put both thumbs together. And again, a lot of this pressure is by using body weight, not just by forcing with your hands. Just make sure the pad is in contact with skin. It's not just the thumbs that are making contact. Palm of the hand goes up the outside. And again, just be careful, this can be sore. Give it a really good shake. Turn and face them. Alternate thumbs. Double thumbs. The hand goes up the outside. Give it a release the thigh area down to the calf region. On the inside, upper hand picks up, lower hand slide and squeeze. So it's just a miniature version of what you've just done on the inside of the thigh. So this is the medial head of gastrocnemius. Coming onto the Achilles tendon, use the webbing between the index finger and the thumb and push that quite firmly. So you've curled the finger so you can actually grab hold of the Achilles tendon. And alternate hands, now be careful because sometimes this can be really sore and the person doesn't realize it until you start to grab. So it's a really good alternate hands. Turn and face them. Alternate thumbs onto the lateral head of gastrocnemius. Put both thumbs together and split the two heads of gastrocnemius, the medial head and the lateral head. Just split the two heads. Using the pads of the fingers and just flick, either using one hand or alternate. One hand and then the other hand. Again, start slowly and softly. Speed and pressure can be built up later. Medial head, gastrocnemius. Upper hand picks up, lower hand slide and squeeze. Achilles tendon, soleus. Alternate thumbs onto the lateral head, gastrocnemius. Split the two heads. Flicking. Behind the bones that stick out, you should be looking at your nails, so the pressure is going straight down toward the ground, pushing behind the bones that are sticking out. These are often referred to as ankle bones, but they're not ankle bones. Turn, so you're trying to push the finger pads together to try to get underneath the Achilles tendon. And then from there, using this pad of muscle here, make circles around calcaneus. So you can push fairly firm, and it's just a circular movement around calcaneus. Move to the end of the table, pad to the fingers, straight down towards the ground. Try to get underneath the Achilles tendon. Circles around the heel. Move around to the side of the table. As you do that, pick up their leg. Their leg can come very close towards their backside, or it can either come out towards you, using your thumbs into the sole of the foot. And again, just be careful. Some people might be ticklish, so they might not like this. If you prefer to use fingers, you can use your fingers. Squeeze the heel. It's just a matter of trying to bring the index fingers, the fingers and the heel of the hand together to make a circle around the heel. Stroke down the calf area. Put your hand onto the foot, but just make it on toes. And then very gently and gradually just push the foot down. You may do this several times. It can be quite firm, but don't get aggressive. Breaking the ankle. Change the hands over. So you can find there's a little hollow just to the lateral side of the tibia. And as you're working down that area, pump the foot at the same time. So there's the hollow just there. So pressure is going from ankle to knee. One hand onto the foot, the other one underneath the heel, and just roll the ankle. Move to the end of the table. Just see if you can wobble the calf area. Interlock your fingers, pull and shake. Move around to the side of the table, pick up the leg, thumbs into the sole of the foot. Squeeze the heel, stroke in the calf area, and push on, break their ankle. Change the hand positioning. Find the hollow, pumping the foot at the same time. wobble the calf area, interlock your fingers, pull and shake. Stroke over the leg. This time, because there's a muscle mass of the areas, hamstrings and calf area, we can do some picking. Also onto the calf area. Start slowly and not so much heavy pressure. You can always gain that later. Stroking. Hacking. Stroking. And some cupping classes. Stroking, stroke on the whole leg, give it a good shape, make it happy, and then cover up the area. Stroke over, upper leg picking. Lower leg picking. Just the muscle mass areas, you can do this on both areas, but not at the front. Hacking. And your clapping.